Let's discuss the food organs. For today, we discuss the gallbladder, the stomach, and the small intestine. 6 food organs refer to the gallbladder, the stomach, small intestine, large intestine, urinary bladder, and the triple burners. Most of them are hollow organs, and their common functions are to receive, digest, transmit, and excrete the food. Therefore, they are characterized as sedating but not storing, and solid but not full. The process of food digestion, absorption, and excretion are the results of connection and cooperation among the 6 food organs. Let's first discuss the gallbladder. The gallbladder is located under the right hypochondriac region attached to the liver. It is one of the 6 food organs and belongs to the extraordinary food organs. The gallbladder has exterior-interior relationship with the liver. The key points here are its 2 physiological functions. First, it stores and excretes the bile. Second, it governs the power of decision. The gallbladder stores and excretes the bile. This is the main function of the gallbladder. The bile is transformed by the liver essence. After bile is produced by the liver, it is stored in the gallbladder and directed by the dredging and dispersing functions of the liver. Later, the bile is excreted into the small intestine to participate in the process of digestion. Failure of the liver to dredge and disperse the gallbladder itself will affect the excretion of the bile and disturb digestion and absorption, leading to descending pain in the hypochondriac region, poor appetite, abdominal distension, and loose stool. Second function, the gallbladder governs the power of decision. The gallbladder is related to physiological activities. It has the function to govern decision. If the gallbladder qi is deficient, the person might be fearful, indecisive, and sleepless. Next, we go to the stomach. The stomach is located below the diaphragm. It connects superiorly with the esophagus and inferiorly with the small intestine. Stomach is an important organ that helps in the absorption and digestion of food. The spleen is located on the left side of the stomach, and both are located in the middle jaw. They form a relationship through mutual affiliation and connect with their meridians. Key points: the stomach has 2 physiological functions. First, it governs intake and the composition of food and drinks. And second, stomach performs its function well when there is descent and free flow. Let's talk more about its physiological function. First, regarding the intake, governing the intake and the composition of food and drinks. Governing the intake simply means that the stomach can accept and contain the food and drinks. Decomposing indicates the beginning stage of food digestion in the stomach and when the food changes into chyme. The function of the stomach depends on the propelling of stomach qi. Therefore, it is very important to protect the stomach qi during any treatment. Second, the stomach performs function well when there is descent and free flow. The food and drinks enter the stomach and transforms into chyme. The chyme is then transmitted to the small intestine for further digestion and absorption. Therefore, the stomach dominates dredging and descending. Stomach dysfunction leads to poor appetite, bad breath, epigastric distension and pain, nausea, vomiting, and constipation. Now let's go to the small intestine. The small intestine is located in the abdomen between the stomach and large intestine. It includes the duodenum, the jejunum, and ileum. The small intestine has the exterior-interior relationship with the heart. The key points, the small intestine has 2 physiological functions. First, it receives and digests the chyme, and second, it separates the clear from the turbid. The small intestine receives and digests the chyme. from the stomach and retains it for a certain period of time for digestion. Dysfunction of the small intestine will lead to indigestion, abdominal distension and pain, diarrhea, and loose stool. Second function, it separates the clear from the turbid. The clear refers to food nutrients and the turbid refers to the wastes of the food. After further digestion of the chyme, the small intestine separates the food essence from the wastes and absorbs the essence and transmits the waste to the large intestine. Because the small intestine absorbs a great amount of water, there is a saying, the small intestine dominates thick fluid. If the small intestine is abnormal in separating the clear from the turbid, the stool will be sloppy and the urine will become scanty, or it may lead to profuse urination and constipation. Therefore, the therapy for diarrhea in clinical setting is often to promote urination. Thank you for your attention.
Let us go to interviewing. The topic is itchy ears. In acute cases, itchiness in the ears is due to invasion of wind heat in the lesser yang channels. In chronic cases, it is due either to blood deficiency leading to internal wind or to kidney indeficiency with empty heat. When the itchy ears is due to damp heat in the gallbladder, besides it being itchy, there will be earache, dizziness, tinnitus, headache, sticky taste, hypochondrial pain, fullness and distension, nausea, vomiting, inability to digest fats, yellow complexion and eyes, irritability, feeling of heaviness, unilateral or bilateral thick sticky yellow coating, and the pulse will be slippery and rapid. The acupuncture points to be used for this is gallbladder 43, triple burner 5, Ren 12, Ren 9, Spleen 9, triple burner 17, and gallbladder 2. When it is due to invasion of wind heat, the ears will be itchy with sudden onset, aversion to cold, fever, sore throat, headache, body aches, slight sweating, tongue with red sides and or front, and a floating rapid pulse. Acupuncture points for this is LI4, triple burner 5, bladder 12, lung 7, and triple burner 17. When there's blood deficiency with internal wind, besides the ears being itchy, there will be dryness of the skin around the ears, crusts on the ears, blurred vision, dizziness, giddiness, numbness, pale and stiff tongue, and the pulse will be choppy or fine and slightly wiry. When it is due to kidney indeficiency with empty heat, there will also be dizziness, tinnitus, night sweating, dry mouth with desire to drink in small sips, backache, poor memory, dark scanty urine, five-palm heat, malar flush, feeling of heat in the evening, and the tongue will have a red coating and the pulse will be floating empty and rapid. The normal ear shape should be of average size without dryness or scaling. Healthy ears are also free of sores, boils, or swellings. If the ear is small and thin, the indication for that is insufficient congenital essence or kidney qi. When the helix is dry with scales, that is an indication of blood stasis. When there are sores, boils, or swelling and redness on the helix, that is usually an indication of wind heat or liver and gallbladder fire. The appearance of a small amount of earwax is considered normal. However, the appearance of yellow or white pus or blood are considered pathological. If the ear discharge is just wax, that is normal. When there's yellow or white pus, it's kidney indeficiency fire with damp heat in the liver and gallbladder channels. When there is blood, that's an indication of heat in the blood. And the normal ear color and sheen should not favor any of the 5 colors or appear withered, parched, or burned. When the ear is withered and parched, that's an indication of exhaustion of kidney qi. When it is white, there's a sudden onset of wind cold or cold. When it's green-black, there's usually an excruciating pain. Black is kidney failure. Red, excess heat or damp heat. Red collateral on the back of the ear that feels cold to the practitioner's touch is a prodrome of measles. And yellow is an indication of damp heat accumulation in kidney. Thank you so much for your attention.
We proceed to diagnosis according to the 5 phases. This time we discuss key phase or the Q phase in salting patterns. In these imbalances, the controlling phase is dominated or exalted by the phase that comes after it in the co-cycle. There will be signs and symptoms that the phase that should be controlled by the other phase is excess, while the phase that should be the controlling phase in the co-cycle will be deficient. The imbalance can be treated by draining the sun point of the insulting phase's channel. For example, if the wood phase insults metal, the wood phase's sun point is drained. In this example, liver 2 would be drained. The deficient phase can then be tonified via its mother point, in this case, lung 9. Wood insults metal. This pattern is similar to the Zhangfu pattern of liver fire invading the lung. This will manifest as cough with yellowish or bloody sputum, dyspnea, chest oppression, and hypochondriac tension, irritability, and the left quan pulse position is full. Acupuncture treatment. The liver's fire point, liver 2, is drained, and the lung's earth point, lung 9, is tonified. Metal insults fire. This pattern corresponds to the Zhangfu patterns of lung and heart qi deficiency, manifested by palpitations, insomnia, lack of joy, shortness of breath. The right chun pulse is full. Acupuncture treatment. The lung's water point, lung 5, is drained, and the heart's wood point, heart 9, is tonified. Fire insults water. This pattern is similar to the Zhangfu patterns of kidney and heart yin deficiency heat. Symptoms and signs are palpitations, insomnia, dry mouth at night, dry throat, lumbar soreness, malar flush, dizziness. The left sun position is full, and the left chi pulse is weak. Acupuncture treatment. The heart's earth point, heart 7, is drained, and the kidney's metal point, kidney 7, is tonified. Water insults earth. This pattern corresponds to the Zhangfu pattern of spleen and kidney yang deficiency. Symptoms and signs: loose stools, edema, aversion to cold, fatigue, weak limbs. The left chi position is full, and right quan position is weak. Acupuncture treatment. The kidney's wood point, kidney 1, is drained, and the spleen's fire point, spleen 2, is tonified. And finally, we have earth insulting wood. This pattern corresponds to the Zhangfu pattern, liver damp heat. Symptoms and signs are jaundice, hypochondriac tension or pain, nausea, loose stools. The right quan position is full, and the left quan position is weak. Acupuncture treatment. The spleen's metal point, spleen 5, is drained, and the liver's water point, liver 8, is tonified. Thank you for listening.
Let's now proceed to diagnosis according to 4 levels. With the pattern Shi, heat agitating She, or blood heat agitating blood. Qi level or blood level. In this pattern, pathogenic qi has penetrated down to the deepest level of blood. This is the final stage in a disease development. The symptoms are serious and complex, and remission is difficult. This is because it is the body's most fundamental substances, qi or blood, and yin, that are injured. It is mainly the liver, heart, and kidneys that are affected. The liver and heart are affected because they have a relationship with blood, and the kidneys because yin is seriously injured. The extreme heat can generate wind that disrupts the movement of blood and further injures yin. Qi level patterns are included for the sake of completeness. It is unlikely that you will see this in an ordinary clinical setting. Patients with these symptoms will usually be admitted to an intensive care unit of a hospital. Qi heat agitating Qi. The heat causes blood to become chaotic in its movement, and blood is so agitated that it ruptures the walls of the vessels. The heat and deficiency yin will mean that the shen is not rooted at night, and there will be extreme restlessness and insomnia. The agitation of shen by the heat can be so extreme that there is mania or delirium. Because yin is injured, there can also be classic yin deficiency signs such as hot palms of the hands and soles of the feet, night fever, a rapid but fine pulse, and a red tongue without coating. its etiology can be rooted to the pathogenic qi that has penetrated from qi or yin level. Symptoms and signs. There will be bleeding of dark red blood from the mouth, nose, lungs, anus, vagina, under the skin, and etc. There will be high fever that is worse at night, insomnia, restlessness, delirium or raving, mania. The palms of the hand and soles of the feet are very hot, very red tongue with elevated papillae and no tongue coating, very rapid and fine pulse. And the key symptoms will be bleeding from bodies orifices, night fever, very red tongue, and a rapid fine pulse. Treatment principle, we drain blood heat and stop bleeding. For the acupuncture points, we can choose from all the jingle points, the Sichuan points, EX, upper extremity 11, urinary bladder 17, UB40, spleen 1, spleen 10, LI 11, liver 4, liver 3, pericardium 3, and do 26. For the needle technique, we use training. We can bleed pericardium 3, urinary bladder 40, the jingle, and the Sichuan points. Do 26, the jingle and Sichuan points drain heat and restores consciousness. Spleen 1 and liver 1 stops bleeding. Urinary bladder 17, UB40, spleen 10, liver 2, pericardium 3, and LI 11 drain blood heat. The person will probably be in an intensive medical care. Qi heat or blood heat, agitating blood, can be caused by qi level heat or yin level heat. And in turn, it can result to yin and blood deficiency. Thank you for listening.
Let's go to treatment principles and talk about qi regulation. Adjustment to person. This means that when considering which herbs to use in treatment, it is important for the physician to consider not only the characteristics of the illness, but also the patient's characteristics such as age, gender, underlying constitution, and lifestyle. Such personal factors must be taken into account in conjunction with the hour and local factors. However, comparatively, the personal factors are more salient than the hour and locale factors. This is because in the causation and progression of illness, the hour and local factors must act through the personal factors so that the complex pathological effects reflect the peculiarities of the person. The value of CM lies precisely in its recognition of the commonality of the many manifestations of any one illness while emphasizing the uniqueness of each patient. Personal factors are analyzed generally from the two perspectives of prenatal endowment and postnatal acquisition. Since humans live in society, the social circumstances affects them constantly. Such effects may be expressed at both physiological and pathological levels. The mind can readily remain healthy. In the converse, illnesses can occur easily. In a time of peace, the people are secure, content, well-fed, and warm. The main illness are those of excessive changes or overindulgence in sexual activity. In wartime and during social upheavals, illnesses of physical exhaustion and illnesses of the spleen and the stomach due to irregular diet are common. Also, when people abruptly switch from one circumstance to a drastically different one, the emotions often change, and the effects of such emotional changes must not be neglected. Since patients differ in overall size, degree of thinness or fatness, robustness, and propensity to warmth or coldness, when choosing a treatment approach, the physician must first determine the ampleness or deficiency of blood and the purity of qi. The ancient physicians categorized persons by constitutions as follows: those of high yin, those of low yin, those of high yang, those of low yang, and those of balanced yin and yang. CM posits that these 5 different constitutions predispose to different responses to the same pathogenic evil and affect the course of the illness. Thus, a person of high yang is at more risk for the generation of endogenous heat or fire, and a person of high yin is at more risk for the generation of endogenous cold. A stout person is more prone to illnesses of strength, and a weak person is more prone to illnesses of deficiency. In a person with dark complexion and yin deficiency, thinness of the body is associated with a propensity to to generate endogenous fire, so that dampness easily transforms into heat and can damage the body fluids. The approach to treatment required is opposite of that for yang deficiency. Those who have a thick stomach, dark complexion, or large bones, or are obese are more resistant to poisons. Those who are thin or have a thin stomach are less resistant to poisons. Qi regulation is a method that is designed to correct abnormalities of qi regulation in order to restore qi movement in the body. The three applications are promote qi flow, lower qi, and raise qi. Promote qi flow is mainly applied to mobilize liver qi that has become stagnant. It also is useful in stagnation of spleen qi or lung qi. The lower qi in some illnesses, lung qi or stomach qi ascends abnormally, causing such symptoms as hiccup, labored breathing, and mental disturbances in one case and vomiting in the other. By this treatment method, this abnormal ascent of qi can be suppressed. To raise the qi, this is applied mainly in illnesses in which spleen qi fails to ascend. It is often used in conjunction with strengthening of the spleen. Before applying this treatment method, ensure that the diagnosis is correct. If it is used when the proper treatment is to augment qi, it may cause further qi deficiency. Conversely, if qi augmentation is applied when the proper treatment is qi mobilization, qi stagnation may be aggravated. Thank you so much for your attention.
Diagnosis according to Zhang Fu organ pattern, spleen qi sinking. Spleen qi sinking is almost the same as spleen qi deficiency. The difference between the two is that when there is spleen qi sinking, there are specific symptoms that relate to spleen qi failing to carry out its function of lifting and holding organs and structures in the body in place. This can manifest in anything from a mild dragging sensation in the body to a prolapse of organs or structures, for example, hernias and rectal prolapse. Spleen qi is also needed to hold the fetus in the uterus during pregnancy. Spleen qi sinking can therefore also manifest with spontaneous miscarriages. Apart from the relevance of the same etiological factors that can result in spleen qi deficiency, factors such as repetitive lifting of heavy objects will weaken kidney yang, which supports the spleen in its function of lifting and holding things in place in the body. Symptoms and signs: organ prolapse such as uterine prolapse, rectal prolapse, hernias, hemorrhoids, dragging sensation as if the insides are about to fall out of the body, fatigue, loose stools, poor posture, difficulty sitting up straight, desire to lie down, limp muscles in the arms and legs, facial muscles appear weak so the cheeks are hanging, craving for sweetness, poor appetite, disinclination to speak, pale swollen tongue with swollen sides and teeth marks, deep and weak pulse, especially in the right quan position. Key symptoms: organ prolapse, dragging or sinking sensation, fatigue, and weak pulse. Treatment principle: tonify and raise spleen qi. Acupuncture points to choose from: we have stomach 36, spleen 3, spleen 6, REN 6, REN 12, DO 20, UB 20, UB 21. Needle technique is tonifying. Moxa should be used on REN 6 and DO 20. Stomach 36, spleen 3, spleen 6, REN 12, UB 20, and UB 21. Tonify spleen yang. REN 6 and DO 20 together raise and lift qi throughout the body when used with moxa. As well as following the advice that is recommended when there is spleen qi deficiency, it is important that the patient avoids heavy lifting. Spleen qi sinking can be caused by the following patterns of imbalance: spleen qi deficiency, spleen yang deficiency, kidney yang deficiency. And spleen qi sinking can result in spleen qi not holding blood inside the vessels and kidney yang deficiency. To recap, we have spleen qi sinking again, which is otherwise known as center qi fall. Etiology: excessive consumption of cold and raw foods, which hinder the spleen, irregular eating and eating too much, excessive mental activity, standing for long hours every day, childbirth, menopause, prolonged exposure to damp, chronic illness. Underlying or accompanying pathology are spleen qi deficiency, stomach qi deficiency, lung qi deficiency. Signs and symptoms: poor appetite, slight abdominal distension following food, pale complexion, tiredness, weakness of the limbs, loose stools, depression, tendency to gain weight, bearing down sensation in the abdomen, prolapse of stomach, uterus, anus, or bladder, frequent and urgent urination in infants, depressed fontanelle. Halls, empty or weak, tongue is pale. Treatment principle, supplement the center and boost qi, raise yang, and rectify the fall. Acupuncture treatment, Ren 12 to supplement spleen qi, spleen 3, yuan source point of the spleen, bladder 20 to supplement spleen qi, which is chronic, do 20 to raise the qi, stomach 21 to supplement stomach, rectify prolapse of the stomach, do 1 for prolapse of anus. Stomach 36 to supplement spleen qi, spleen 6, supplement spleen qi, bladder 21 to supplement stomach and spleen qi, and Ren 6 to supplement and raise qi. Needling is tonifying or supplementation and moxa. Thank you for your attention.
Let's discuss diagnosis according to Chinya imbalances, and we continue with the third part on the topic of phlegm. Let's take a look at its etiology. Phlegm often arises when heat condenses body fluids, when spleen qi deficiency creates dampness, when there is stagnation of qi or blood that stagnates the body fluids, or when there is lack of yang to transport and transform fluids. Phlegm can also be created by the diet that a person consumes. This could be foods that weaken the spleen, create dampness or heat, or have a phlegm-producing dynamic. The symptoms and signs are as follows. Fatigue that is worse in the morning, difficulty getting going and being mentally absent in the morning, increased need for sleep, lack of appetite, especially in the morning, nausea or vomiting, heaviness in the chest, cough in the morning. The sputum can be loose or sticky depending on whether there is heat present. There will be shortness of breath, dizziness, heaviness in the head, blurred vision and dull eyes, sleep in the eyes, dark sooty color around the eyes, depression, melancholy, mental confusion and difficulty thinking, especially in the morning, incoherent speech or talking to themselves, difficulty concentrating, skin and flesh tissue can lack tone and be doughy, the skin lacks luster, the fingers can be thick and chubby, increased growth of body hair, tendency to obesity and plumpness, symptoms and signs that are triggered or provoked by weather changes and perfume, petrol, or solvents. Symptoms that are provoked by consuming phlegm-producing foods and drinks, numbness, greasy or oily skin and hair, sticky taste or sensation in the mouth, thick saliva or saliva in the mouth, mucus in the menstrual blood, fibroids and nodules, fat nodules under the skin, deformed joints, heavy sticky odor, repeated need to clear the throat, gravelly voice, nasal voice, swollen tongue, tongue that is limp or has a flabby tone, sticky or greasy tongue coating, in a slippery or wiry pulse. The key symptoms are fatigue and mental absence in the morning, lack of appetite in the morning, sticky sensation in the mouth, symptoms and signs that are triggered or provoked by weather changes, perfume, petrol, or solvents. Treatment principle, transform and drain phlegm. For the acupuncture points, we can choose from stomach 40, stomach 36, Ren 12, spleen 3, spleen 6, spleen 9, UB20, and UB21. For the needle technique, we drain stomach 40 and spleen 9 and tonify the rest of the points. Stomach 30 drains phlegm. Spleen 9 drains dampness. Spleen 3, spleen 6, stomach 36, Ren 12, UB20, and UB21 tonify spleen qi and transform phlegm. The relevant advice will depend on which individual pattern have been involved in the creation of phlegm. Nevertheless, there are some general guidelines that are relevant for all individuals who present with phlegm imbalances. Diet is very important, and they should avoid foods and beverages that produce dampness and phlegm, including dairy products, bananas, sugar, things that taste sweet, such as dried fruit, honey, stevia, and so on, wheat products, fried food, and alcohol. Nuts are interesting in this context because eating too many nuts creates phlegm, but eating a small, limited amount of almonds or walnuts can transform phlegm in the lung. In general, a person with phlegm will benefit from eating food that have a slightly spicy flavor, such as watercress, radishes, turnips, daikon, garlic, pepper, herbs, etc. It is also important that they do not eat too much at a time and do not eat too late in the evening. Phlegm can be caused by spleen qi deficiency, lung qi deficiency, dampness, yang deficiency, yin deficiency, heat, cold, qi stagnation, blood stagnation, and food stagnation. In turn, it can result to heat, qi stagnation, blood stagnation, spleen qi deficiency, lung qi deficiency. Thank you for your attention.
Let us now talk about diarrhea, the spleen and kidney yang deficiency. The clinical manifestations of spleen and kidney yang deficiency are early morning diarrhea, slight abdominal pain, borborygmi, which stop after the bowel movement, weak back and knees, dizziness, tinnitus, feeling cold, cold limbs, frequent pale urination, tiredness, poor appetite. The tongue will be pale and wet and the pulse weak and deep. The treatment principle is to warm the kidneys, strengthen the spleen, and stop diarrhea. The points to be used are REN 12, bladder 20, stomach 36, spleen 6, bladder 23, bladder 25, stomach 25, stomach 37, REN 6, and DO 20, using the reinforcing method and MOXA. The explanation for these points is REN 12, bladder 20, stomach 36, and spleen 6 tonify the spleen. Bladder 23 tonifies kidney yang. Bladder 25 and stomach 25, back transporting and front collecting points of the large intestine, they treat chronic diarrhea. Stomach 37, the lower C point of the large intestine, stops chronic diarrhea. In REN 6 with moxa tonifies qi and stops diarrhea. Indirect moxibustion on ginger is a very effective method of treating this type of diarrhea. And DO 20 raises sinking qi. Let's talk about a case history of a 30-year-old man who had been suffering from diarrhea since he was 16. His stools were always loose and occasionally like water, and he had up to 8 bowel movements a day, all in the mornings. His sleep was poor because he woke up frequently during the night, feeling his throat dry. He also suffered from tinnitus and impotence. His pulse was fine and deep, and his tongue was slightly red and swollen, with a coating slightly peeled in patches. The diagnosis is a condition of deficiency of both kidney yang and kidney yin. The symptoms of kidney yang deficiency are impotence, diarrhea in the mornings, and swollen tongue. And the symptoms of kidney yin deficiency are red tongue, peeled coating, tinnitus, insomnia, and dry throat. The treatment principle is because the diarrhea was his main concern, because the frequency of bowel movements in the morning severely interfered with his work, so attention was directed at treating this first. In order to treat the diarrhea, kidney yang should be tonified and warmed. However, he suffered from a deficiency of both kidney yin and kidney yang, and tonifying and warming the latter with a kidney yang herbal formula would definitely aggravate the former. In such complex cases of deficiency of both yin and yang, acupuncture is often preferable to herbal medicine, because with acupuncture, the kidneys can be strengthened in general without any special emphasis on yin or yang. The acupuncture points used with the reinforcing method were chosen from the following: stomach 37 and bladder 25 to stop chronic diarrhea, bladder 23, kidney 7, REN 4, and REN 6 to tonify the kidneys, heart 7, and kidney 6 to calm the mind and promote sleep. This patient needed treatment for over a year in order to achieve a cure, as his condition was very long-standing. The prognosis is his diarrhea responds very well to treatment with acupuncture and herbs. Acute diarrhea responds practically immediately, and acupuncture and herbs or patent remedies are probably the medicine of choice in his condition. As for chronic diarrhea, this naturally takes longer to treat, and occasionally it may be very stubborn. If it is due to kidney yang deficiency, male patients should reduce the level of their sexual activity. Thank you so much for your attention.